a little bit nicer. Let's see. Check this out. We can still talk. It's not a big deal. Let's see what I got going on here. I'm going to do a screen share. Hey, everybody. My name is Derek Robinson. If you don't know me, this is Dr. Ryan Evans. We'll start in a few minutes. So in the meantime, I'm going to put up a nice little welcome sign just to kind of show our love to y'all. I don't know if you can see it there. I might have to ask Dr. Evans every now and then if it's connected. So we'll be getting started in a couple minutes, but feel free to start throwing in some questions if you guys are interested, and we will start to slowly integrate them into our conversation. I'll start off in a few minutes. I'll start talking about our free CE opportunities that we have, and then we'll get down to business. Oh, and just a heads up, by the way, there will be some opportunities in order to have conversations later on. So feel free to join later. I know that this is going to be an hour long. So, and on top of that, I believe a lot of the UCLA students are going to be jumping on a little bit late. So let's give it a few more minutes. We'll get started. And I will actually let's put this on so that we can go smooth. Let me see if I can do this properly. So I apologize about my technological advances, but this is what we're going to be talking about.
Looks good.
Looks good. Does it look like this still?
Yeah, that's exactly what it looks like.
Cool. All right. Give it a few more minutes. If anybody is on right now that can see it, aspendentalce.com/welcome. Those are our free CE opportunities, and there's also thousands and thousands of CEs that were recorded in a library that are on there. And if you have any questions, feel free to reach out to me. I also have Dr. Evans' contact information and my contact information if you have any questions afterwards as well. So Doc, just to give you an idea, I received about 15 or so questions.
Okay.
So I'll make sure to try to order them as well as we possibly can when it comes to that.
Yeah, no problem. We can just just fire them off as they come, and yeah, man.
Yeah. You know what? Let's actually get started, and we'll do this real quickly. I'll do a 2-minute introduction, and then once people start to come on, they'll be able to hear your part, which is probably the most important part. So my name is Derek Robinson. I've been with Aspen Dental for 3 years now, mostly in the academic setting. So if you've gone to any events or done anything on campus with Aspen Dental in the districts 10 or 11 ASDA, you probably connected with me. You've probably also connected with some of my other colleagues all throughout the United States. Our main focus is just to make sure that we educate you guys as far as how many opportunities and resources are available if and when you do decide to join Aspen Dental. We have a blast every time we go out. So unfortunately, due to COVID, we're kind of probably be sticking a little bit more to the virtual capacity. But in the perfect world, we will be at your school, whether that's UCLA or any of the other District 11 schools. I only say that because I got Dr. Evans from UCLA right here. On top of that, if there's any other ideas that you guys might have regarding opportunities, especially at the beginning of the year, and you are willing to meet face-to-face, hit me up, let me know, and we can have a good time doing that. With that said, I'm going to go ahead and introduce Dr. Ryan Evans. Hi, Dr. Evans. How are you today, and how was work?
Hey guys, I'm doing great. Work was good. It was a pretty smooth day. Couple people showed up late right at the end, but yeah, it was a solid day out here in the desert.
Nice. So tell me a little bit kind of about yourself to the average person that may not know anything about you.
Yeah, sure. So yeah, my name is Ryan. I grew up in Southern California in a town called Rancho Cucamonga. Parents still live there. I went to UC Santa Barbara for undergrad, took a year off, and then went to UCLA for dental school. After I finished up there, I started working with Aspen, went out to Texas for 2 years. And about a year ago, came back to California to help start opening up here in Northern California and now here in Southern California.
Right on. Well, thanks for that intro. We'll be getting to know you a heck of a lot more, probably more stuff than I even know about you right now. All the stuff that we've been through the last few years. So just one more time, welcome to everybody. Before we officially get started with the questions, again, we are offering free CE opportunities, not just to our current docs, but also all licensed doctors and even all dental students. So this is a huge opportunity. We're opening up our entire library to everybody. So if you can see on the screen, aspendentalce.com/welcome. We'll get you to the site. Feel free to sign up and check it out. It's a pretty amazing opportunity, and I'll let Dr. Evans kind of talk about his experiences on that a little bit later. I'm going to do my best to allow some of the questions to come in, but we did receive a handful of questions that came in prior that I've kind of put in order. So I want to make sure that we kind of follow them in order, kind of like a beautiful biography of Dr. Ryan Evans. And then from there, I'll try to implement those questions from the inside. So with that said, I'm going to get this screen off so you can see our beautiful faces a little bit more. All right. A little bit bigger now. We got a bigger crowd.
There we go. All right. Yeah, like you said, we'll go through the pre-listed questions, and if your question isn't answered, feel free to send it in the message box, or you can get my information or Derek's, and reach out to us directly as well.
Yeah, I got that at the very end. I without your authorization, I put your Aspen Dental.
Perfect. You get my cell phone number too.
Cool, man. So okay, so let's start off. Experiences in dental school and job searching. So. We'll do it nice and easy. We'll start nice and slow. What was your most memorable experience at UCLA in dental school?
Oh man, well, I mean, in dental school, I was super involved with ASDA. So from first year on, I started getting involved with ASDA. Made a bunch of friends that I'm still close with today. Started going to the events around the country. Meeting different, meeting all sorts of different people, both dental students and non-dental students, and through that network is where I got involved with Aspen Dental. I met a recruiter. His name was Chris Robinson, who unfortunately is no longer with the company. But him and I got along really well. Every event he would take me and my friends out, and I would just always ask him questions. He'd take me and my friends out to dinner, and I would tell him, like, Chris, you're wasting your time. I'm never going to leave California. Like, I have nothing against Aspen, but I'm just never leaving Southern California. And he was like, it's all good, man. It's part of my job. And, so it was great. It was like a 3-year relationship where him and I hung out a few times a year, always stayed in touch. And then in my 4th year of dental school, probably around November, I started a job search. And man, was it tough in Los Angeles. I interviewed at a few places, and it was mainly, just per diems, just one day here and, in the Valley, one day in downtown. I went to one office in Venice Beach, gorgeous office, awesome doctor. And he was like, yeah, you can work on Wednesdays and, do fillings and prophies. And that was the day I was like, oh man, this is not going where I want it to go. So I reached out to Chris. And, we kind of went back and forth, and, we settled on Texas. And, about a month and a half after finishing school, I moved to Texas and started working as an associate.
You just took like 9 of my questions off the board.
I thought that was all part of the question.
Totally. So like during the process, when did you know, like, from a time frame that you said, all right, now, when you mentioned going to that Venice location and then saying, all right, now I need to figure out what I need to do, and reaching it back out to Chris, when was that kind of during the academic year?
That was, I want to say it was early January. So January of 17, and, I graduated that June. So it was about 6 months before graduation.
Okay. So pre-licensed, pre-completion, you committed to Aspen Dental.
Yeah. I think I signed up. It was either late February or early March I signed on.
Right on. So I'll be adding in my own 2 cents every now and then. That is something that we have as far as the resources that go for dental students that are currently dental students is, you have the ability to start inquiring now. I know, especially during this crazy time, it's going to be a little bit harder or go face to face with individuals. And, these are the opportunities, especially starting day one in your 4th year, where you can start figuring it out. And if you feel like you're ready and and you've done your research, you can start as soon as possible. And that basically is all contingent upon your license getting started. So when did you officially start?
I think it was the last day of July, 2017.
Okay, cool.
Uh-huh.
And how did that transition as far as going from California out to Texas, and what was that kind of process like?
Yeah, so I mean, the move itself was pretty crazy. So I have an old pickup truck that I packed up with my boxes and everything. Just started this long drive. It was so much longer than I was expecting. I hit Texas and I was like, oh, cool, I'm here. But little did I know that was only about the halfway mark. Just that West Texas is massive. At one point it started raining. I go and I was like shoving things into the cab of my truck. It was an adventure, to say the least. But the transition, other than that, couldn't have been smoother. So it turns out the doctor I ended up working for, Dr. Tawati, who I'm still friends with today, him and I didn't know each other prior to me moving out to Texas, but it turns out him and I had we had a really good mutual friend who kind of vouched for both of us. So I ended up, I took the job with him, and he was like, hey man, you can just move into my house. So I moved to Texas, moved into his house. He let me live rent free for a couple months. This
is your owner, Doc, right?
Yeah, this is my owner. He owns the office I was working at. So, he was mentoring me at the office, and then, we became really good friends outside of the office. So, having someone like him really made the transition easy for me.
Well, that might not be, and I'm looking into the camera at everybody, that may not be your situation, but if it is that situation, it has happened before, which is awesome. And Dr. Altawati, by the way, shout out, he was a graduate of USC Austral School of Dentistry 2014. So
yeah, he was 14.
Very strong presence out in Texas from the California schools. What was the biggest difference in flow from clinical rotation in school to Aspen Dental?
Yeah, I think, the biggest transition, and I think this is the case no matter what setting you transition into, whether it's private practice, a specialty program, residency, and that's just, seeing more than 2 patients a day. There's, in dental school, it's like you set up at 9 o'clock, you do your 1 crown prep, you finish the temp at 11:30, you get your stuff signed off, and you get off to lunch, and everything was good. So really just that flow of seeing more than 1 patient at any given time. That was another thing that, I know Aspen does it, but Dr. Altawati especially did for me was, we started off slow. We started off by only booking, 1 or 2 patients in the morning and 1 or 2 patients in the afternoon. And then, about every week and a half, we just started upping it. So it wasn't until, probably at least almost, a month and a half in, that I started even slightly starting to do multiple chairs. So it was definitely a nice progressive transition in. And, I was always very on top of looking at the schedule. So, I would look at something the day before, and if I thought there was going to be, a delay or a patient was going to have to wait a little bit too long, we would just change the schedule around a little bit. So I would say the transition was, it was a pretty smooth process, but the biggest thing is definitely just, doing more than 1 thing at a time and seeing more than 1 patient in a session.
Okay, so it got a little bit busier than what you experienced is what it sounds like.
Oh, absolutely.
Just a little bit, right?
Yeah, just a little bit. The first couple of months, it's like, you just want to make sure you're getting the IA numb, that you're not doing anything, completely wrong. And, once you realize that, you just trust your training and just do what you've been trained for and do what you think is right, it just starts flowing smoothly.
So on that note, we'll definitely make sure to talk about mentorship, kind of who, obviously Dr. Tawati was helping you out with mentorship and kind of all the different services. Well, let's actually talk about it right now. What perks are available for a doctor straight out of school? Which one did you feel like you used the most?
Yeah. Oh man. So the mentorship aspect was the greatest thing for me. Working with Dr. Altawadi, helping me out day in and day out. And then, as Derek had alluded to earlier, there's a lot of nationwide events. They can be both continuing education, like the Invisalign training programs, or just, a fun celebratory conference. But you end up meeting people from all over the country. So, when I started doing some implant stuff, there were some guys in Florida who I knew that were placing a ton and doing a lot of implant stuff. And, because we had become friends in an event, I was just shooting them text messages of x-rays, asking them clinical questions. When I first started doing Invisalign about a year ago, there was a girl she was in Chicago at the time, and she was doing a bunch of Invisalign. So I would just ask her questions. So the mentorship was both in office and just this nationwide network of people that, are only a text message or an email away.
That's awesome. And so how many of those events did you do or participate in per year once a doctor?
Oh man, as many as I could. There was a minute there that I feel like it was almost once a month it was either like a dental student vibe event or something for practicing doctors. There's always something every couple months, every 3 months, there's always a good event to attend.
Right on. So for the 2020 and 2021 grads, the question is, how did your interview process go and how did it work?
Yeah, well, so once me and Chris, the recruiter, we decided, hey, okay, I'm going to do Aspen, what's available. We kind of just started going back and forth with states. The first thing, so actually, let me backtrack. So Chris put me in touch with, I think his name was Roland. Mm-hmm. And then he started throwing states at me. So he was like, how about Alabama? And I was like, I was kind of like, okay, hey, let me look into this at least. And then I went on the Wikipedia and, looked around, but then I realized they don't take REB anyways. So I was just like, hey, they don't take REB. And then they were like, what about Mississippi? And I said, same thing. They don't take REB. And then they're like, all right, what about Texas? They took the REB. I looked around and I was like, yeah, let's do Texas. And then I did mention like, hey, like I'm a new grad. I would definitely like some mentorship. And they were like, perfect. Like this guy. So this was prior to me ever even knowing Dr. Altawadi existed. They were like, hey, there's a guy, his name's Rashad. He's looking for an associate. You guys should link up. So him and I think we talked on the phone a couple times. We messaged back and forth. And then, when you're getting serious in the process and you're actually considering signing on in a location, they flew me out to San Antonio, which, I'd never been there before, got a rental card, drove up to the office. And he came in and he was a little bit like straight faced, like he was trying to be really serious. And within about like 3 minutes of chatting, I was like, oh, do you know Nathan Samaro? And he's like, oh, Nate Dogg. And just from that instant, we clicked and the whole thing was easy. And, by the end of a 20-minute conversation, we were like, all right, this is going to work. Let's do this.
So you feel like he was a pretty integral part of the process and you feel like the mentorship kind of sealed the deal once you met him and you kind of figured everything out.
Oh yeah, definitely. That's one of the biggest things, the biggest assets that a new grad can have is just somebody to bounce things off of. Having somebody around that you trust and you believe in, that you can ask questions about, even some like before a procedure, you can chat about something after a procedure, sometimes even mid-procedure. If they're in the office, you can ask them a question. That is absolutely invaluable. And the friendship, I think, was a cherry on top. If you can become friends with your mentor, that's great. But, just having a mentor, somebody that can, walk you through some things that maybe you've only seen in a PowerPoint, maybe you've only seen in a book, maybe you've never seen before, just asking them some questions is literally worth its weight in gold.
All right. So, mentorship sounds like it was a big part of your your career. So let's start to transition from basically once you get back into, or you're working as a new dentist, how were your first 30 days like?
Yeah, first 30 days, just transitioning into a new state, so still figuring out, where to go grocery shopping and, so all those little weird things, of living somewhere new. But like I mentioned, clinically, so the first few days, actually, I want to say the first week, I didn't even see a patient that was my own. So I just followed Dr. Tawati. He just had his normal schedule, and I just, went about his day with him. And he kind of walked me through, what he was doing, what his thought process was. And, I basically shadowed him for a week. And then the second week was when we started doing, okay, 1 or 2 patients in the morning, 1 or 2 in the afternoon. So the first 30 days were just a good transition into clinical practice.
Right on. And so what type of procedures did you do when you first started?
Basically whatever I was comfortable with. He was pretty cool with it. We started with, fillings and crown preps. At UCLA, we having so many specialty programs, I didn't do a ton of extractions in dental school. And, I knew I wasn't afraid of surgery. Just in dental school, we didn't get to do a lot of it. So I wanted to start doing extractions. So, it was nice having him. He assisted me on my first few, would give me some tips and tricks, after on, anything that I could do to improve my techniques.
Cool. So since, especially when you first started, the question is, what has been your most difficult procedure you've done? So like maybe what was your most difficult procedure that you had when you first started, and what is considered like your most difficult procedure now?
Yeah, well, so what I always say is, it's not the procedures that are difficult, it's the people that are difficult. I swear sometimes it could be the most straightforward crown prep or the most straightforward extraction, but if the person either, I don't know, they could have some sort of dental anxiety. Sometimes I feel like they're just trying to mess with you. But it's really, I think it's the patients that are harder. It's not really the dentistry. I mean, you have to be aware of what you're capable of. Like, your first month or week out, you're not going to be jumping in and doing a sinus lift or, taking out impacted wisdom teeth. You definitely need to be aware of what is in your toolbox, what you're able to do. And yeah, I still think it's patients that are hard. It's not dentistry.
We got a question that came in about the type of oral surgery procedures you feel comfortable with and which ones you'd be willing to refer out.
Yeah, absolutely. So, I mean, I still refer stuff. If I feel comfortable doing something, I'll do it. If I don't feel comfortable doing it, I won't do it. So for instance, like if it's a healthy 22-year-old with a partially impacted wisdom tooth, I'll go for it. No problem. But if it's, an 80-year-old that had a heart attack yesterday and it's, even a pretty simple extraction that, I don't think this patient's stable, then I'll refer that. So it's really just, it's a case by case, patient by patient. And, you obviously don't want to just be referring everything. Like, you want to grow and challenge yourself as a provider, but you definitely you don't want to get yourself into trouble. That's for sure.
Yeah, it's your license, right?
Yeah, exactly. I'm still paying for it.
Right on. That question was brought to you by Guntas Kakar. So he wanted me to make sure I dropped your name, or dropped his name when
Oh man, Guntas is trouble.
You know what? Trouble seems to find the Dr. Evans I know all the time. So heard that directly from me.
Well, we can give a shout out to Guntas. He is in his either second or third year at University of Cincinnati oral surgery.
There you go.
Real questions, you can shoot those his way.
There it is. All right, let's get down to the specifics, huh? How much does a new dentist get paid, and how long are contracts?
Yeah, so the daily.
I'll help you out with that too.
Yeah, you tell me, what is the new daily for these kids?
It's like $1 million or $2 million, something like that.
Yeah.
No, I'm kidding. Obviously Because all of these offices are owned by owner doctors, right? Everybody that owns an office is a practicing doctor that owns this office. And as a responsibility of an owner doctor, that is something that will differ from location to location. Those are the opportunities that you have a discussion. But what we do, we do something called a daily guarantee rate. And I'd be happy to go into detail about that offline for anybody that has questions on what a daily guarantee rate is. Essentially, you can make anywhere from 140,000 to as much. This includes the success of the office as much as 200,000 as an associate straight out of dental school. So, ultimately, depending if money is a huge factor, then those are things that you can look into as a part of the company. Why don't you go into detail a little bit about kind of the profit sharing and kind of, how the office operates from that particular area?
Yeah, absolutely. Well, the other thing, before I get into that, the contract lengths, that was something else that made me feel comfortable signing on with Aspen, is that they're completely at will, meaning there's no non-compete covenants, which aren't enforceable in every state, but there's no non-compete, and then there's no length. So that was something that always made me feel a little bit comfortable. It's like, okay, hey, let's say I moved to Texas, and after a couple months, I just don't like it. There is nothing in my contract keeping me tied to the office, the area, or preventing me from practicing anywhere. So that was something I liked, and I don't think that's changed since I signed on. Then in terms of the profit sharing, like once you get your feet wet and once you actually start working, your daily guarantee really isn't even the biggest concern. So if the office does well, everybody does well. And so that's actually one of the biggest things that I wasn't aware of before I started, but I very early on became aware that it was a bonus. So for instance, I have friends who started working in private practice, and the dentist, whenever he would get, a straightforward bridge or just a simple implant crown, he would keep it because those associates were paid based off of their own individual production. So the owner doctor would keep all of the high production value stuff in his own chair. Whereas with the Aspen model, everybody's kind of contributing to the total office revenue. So, like with Dr. Tawati early on, if I was doing the bridges or I was doing the implant crowns or I was doing the denture, whatever, he had no problem with it because we were all working towards the same goal. So that allowed me to start doing procedures that, in other situations, never would have gotten tossed down to me because of the way the pay is structured.
Yeah. And, just to add on top of that, it's full clinical autonomy in every single office, meaning that everybody needs to work together, and the success of the success of the office is going to dictate the success of that particular individual. So everybody works together for one common objective, is to make sure that they're really focusing on that patient. And with that said, if everybody's really putting 100% of their focus onto that patient, the office is going to be successful. And like Dr. Evans mentioned, and we can go into detail a little bit later about that, that daily guarantee rate is a great security blanket. But once you start to get really into it and you're really focused and you're starting to do your procedures a lot faster and you're getting more quality work done, that is most likely what you're going to be drawn and motivated by, not necessarily that daily guarantee rate. So
there hasn't been 1 month where I've only made my daily guarantee. There's always been profit sharing. The only time the daily guarantee ever really was a factor is like when you're applying to buy a house or a car or something like that. They ask for that.
Exactly. This question is more kind of listed towards the differences, and just do your best as far as what you know about it. What are some of the differences between the average private office and an Aspen office? Would you have any idea kind of?
Yeah, so when I was an undergrad at UC Santa Barbara, I worked in a private practice setting. The biggest differences, I would say, are, mainly just the patient flow. We see a lot more patients. The types of patients that Aspen advertises towards are, it's mainly blue collar workers who, haven't necessarily seen a dentist in a long time. So in the private practice I worked at, it was a lot of 6-month hygiene, maybe replace a crown if necessary, where, more so in Texas than I'm seeing here in California, but it was literally just people coming in, 50 years old, and they're like, I haven't been to the dentist since I was a kid. So, just a lot different dental situation, overall dental health than I saw in private practice.
Cool. Got another question that came in. It's from your big fan who's on. He said, what's your least favorite part of working for a DSO?
Oh man. Well, hi Ojan. So Ojan's been one of my biggest fans for a number of years. So I'm glad you came out tonight, man. What's my least favorite part? I guess,
it's not the culture part. I can tell you that.
No, it's not the culture part. To be completely transparent, sometimes like it would be nice if my name was on the door, like if they were coming to see Dr. Evans and it wasn't to come see Aspen Dental. Sometimes I do wish that it was my name on the door, but there's so many other positives, and I don't mind.
Yeah, and we could have that discussion of all the other positives a little bit later, but I know the financial positives are very high up there. Additionally, too, we're spending hundreds of millions of dollars in marketing. So, the benefit is that you do see a whole ton of patients, right? You see a lot of new patients. The business support side is taking care of all that, and that is just so that it's centrally branded from a marketing purpose. Yeah, I wish my name was on the door too, but I got my address on there. So anyways, all right. I've often heard that DSOs lay off dentists that are not able to meet production amounts detailed within their individual contracts. True? And what production rate is expected?
So yeah, gotcha. So from my experience, so that sounds plausible. Like I'm sure it happens in some places, but from my experience, that has not been the case. So I'm very well aware of the numbers. I understand them, but on a day-to-day basis and a patient-to-patient basis, I really don't care. When the patient's sitting in my chair, I talk to them, I figure out what their goals are. I give them their options, and we come to a solution together. And, sometimes it's the most lucrative decision, and sometimes it's not. But I just do whatever is right for the patient in the chair at that moment. And you end up sleeping better at night if you just know you're doing right by everybody who comes in front of you. You don't have to worry about anything.
And there's something that maybe I'll ask you to elaborate on too, is the patient satisfaction and kind of how that affects your ability to A, more people to come in, and then on top of that, B, there is a little bit of an incentive as well. Can you elaborate a little bit on how patient satisfaction is kind of put into the scale?
Yeah. So the profit sharing is on a graded scale. So if you have so what is patient satisfaction? When patients come through the door, they get an email, and some of them answer it, some of them ignore it, but it just asks them, would you refer a family or friend to this office? And if they score you highly, you have a high patient satisfaction score. And the higher the patient satisfaction score, the higher your profit sharing. So if you're consistently, giving patients a good experience, they consistently like you, you end up getting, what translates to, thousands of dollars every month in additional profit sharing. And not to mention, it's just good word of mouth. And this is the case, obviously, with Aspen, with private practice, but word of mouth is the most important thing. There's TV commercials and this huge marketing budget. But, when people in the local community, like you, they have a good experience and they start referring people, that's as easy as it gets. And it's the most fun.
And you just want people to really like you so that you can have friends, right?
Friends are always good. Yeah.
So this is we're starting to transition into, you've been in Texas, and now the discussion that comes up regarding you thinking about coming back to California. If I start as an associate, how quickly can I become the lead and an owner? So I guess just talk about kind of your your transition from the beginning all the way to where you're at now?
Yeah. Well, so for my situation, it was pretty quick. So prior to me signing on, I had known a lot about the model. I knew about the ownership program, and I knew that's what I wanted to do. And so that was one of the things that led me to Texas, was that there was a lot of ownership and growth opportunity. So I was able to transition into the lead doctor role, I think around maybe 5 or 6 months. So at that point is when Dr. Tawati, he left. He was still there a couple days a week, but he was almost full-time at his other office. So I became the lead doctor after about 5 or 6 months. I was at that office for about 11 months. And then I moved to San Antonio to open a practice from scratch. And the plan was for me to buy that office. So I moved down there with the intention of buying it. And that was what the plan was. So in theory, I could have been an owner within a year. But prior to transacting on that, the California market was opening up, and, the opportunity to come back home outweighed staying in San Antonio. So I elected not to buy out there, but I could have done it in about a year. And so I guess to answer the question, it varies based off the market. Like there's some places, like for instance, Florida, that has a very established, doctor base, and there's a longer timeline from moving from associate into, lead doc. And, there's so many owners out there that a lot of guys who are successful in Florida as lead doctors actually have to leave the state to go find more opportunity. Whereas in, a fresh state like, Texas that was growing, California that's just starting to grow, that growth process, that transition into, more responsibility and a higher role happens a lot faster.
Yep. And on top of that too, I briefly mentioned our goal is to have all approximately 850 of our offices to have an owner, and we're building everything from the ground up. So, if we're opening 80 offices a year, we're going to need at least 80-ish owners in order to own them. So, opportunities are coming. And like Dr. Evans said, he had a chance to do it in Texas, but once you get to the understanding of knowing where the growth is going to be, you can have those conversations. Did you have those conversations with anybody in particular? And if so, how did those go?
I had those conversations with a lot of different people. So I would actually say that's one of the things that, might have helped in my success and me getting to where I wanted to be, is I was always very open and very transparent with what I wanted and how I was feeling about things. Like from the very beginning, I was like, hey, I want an opportunity to grow and to own. And and I told that to everybody, like I didn't hide my ambitions. I wasn't trying to like, some people think, oh, if I let people know what my goals are, somebody else will take it from me. No, it's, there's plenty of opportunity for everybody. So I had those conversations with a lot of different people, and, everybody has something that they can add and something that they can help you with on your journey.
Awesome. Okay. Going back into the office. How many people work inside the average office? It's a three-part question. How many people work inside the average office? What hours does a new student work per week? And how many patients do you see personally?
Yeah. So how many people work in the office? Let's see. There's 2 girls up front. There's me. There's a hygienist. I have 3 dental assistants. So that's 7. And then there's a lab technician, so 8. So right now there's 8 people in my office. We just interviewed both an endodontist and an oral surgeon, so they'll be coming through both once or twice a month, depending on how much we can fill their schedule. But yeah, somewhere between 8 and 10 people, depending on how busy the office is, how many providers there are, is a pretty normal number. Or the other question.
Yeah, that sounds about right. I would also say on top of that, it depends on what office you're going into. Mm-hmm. Right? Like, I'm sure you've come across other owner docs or other lead doctors that are probably in an office with like 12 to 15 people, do double hygiene.
Yeah.
Have other leads, associates, partners, and so on. So you got a fully staffed crew when it comes to all that.
Absolutely. I mean, I'm the only doctor there right now, and there's 8 operatories. I have a cone beam, an iTero scanner. There's actually 2 lab technicians right now because somebody's training. I have a fully staffed office right now, so I have everything at my fingertips.
There you go. So what about as a new dentist? Like, what are the hours typically? What do they typically look like for a new dentist?
Yeah. So most Aspen offices have a pretty similar schedule where they do 3 days a week. So like Monday to Wednesday, 8 to 5. Then there's one late day. So like then Thursday would be 10 to 7, and then half day Fridays, 8 to 1, and then usually one Saturday a month. That's a half day as well. So 8 to 1.
Okay, so on those Fridays you're going to virtual Vegas now that you're so much closer.
Yeah, right. Well, it was really nice when I lived in Texas because that gave me the opportunity to get out of town. Like
Yeah,
I could be on a plane, I could be on a plane by 2 o'clock, and with the time change, I'd be back in California at 2 o'clock, and it'd just be able to enjoy my whole weekend. So,
that's a good
um,
point. I was
yeah,
just messing around, and that's actually a great point right there.
yeah, those half day Fridays are awesome. You feel like you get a 3 day weekend most of the time.
Yeah, that's awesome. Okay, we're going into growing and learning. So, how have you grown since joining Aspen Dental?
That's a deep question, guys. So in terms of as a clinician? Oh man, I mean, just obviously, the more patients you see and the more you do, seeing more clinical outcomes, positive and negative, you learn from that inevitably. Some of the big things that that I've gotten through Aspen is, so about 2 years ago they hired this guy. His name's David Galler. He's one of the prime. He's one of the biggest Invisalign continuing education like gurus, I would say. And so just through courses with him and working with him directly, I feel very confident doing a lot of different Invisalign cases now. Um, yeah, just I've grown a lot. Yeah, I would say there's been these kind of 6 month checkpoints where it's just like as every 6 months go by, I just keep feeling like I'm leveling up. It's just things like I can do. I can do things now that a couple years ago I would have been intimidated by, or I would have left thinking, oh my gosh, I can't believe I did that. The more you do, the more comfortable you get with things. And it just becomes easier and more fun.
Question here: will I do my own treatment planning?
Well, so yeah, that very much depends on the office you're in. So I did pretty much all of my treatment planning since day one. So for me, from my experience, I always saw my own new patients and I always did my own treatment plans. So it might depend on the office you're in. But at the end of the day, let's say a patient's in your chair and there's something you did not treatment plan and you don't agree with it, or you're like, hey, you know what? I need a med release for this or whatever, you can change it up. If something's in your chair and you're not 100% comfortable doing it, don't do it. Talk to the doctor that treatment planned it, figure out why they treatment planned it. If you have something else in mind, recommend it. And that's all I'd have to say about that is, just don't do anything you're not comfortable with.
That's probably good advice for pretty much any office that you choose to go into, huh?
Absolutely. Yeah, no question, man. If you're just blindly jumping into procedures, you're going to get burned eventually.
Yeah, I know that's a very common misconception when it comes to Aspen Dental, and that was a great question as well. Question here: how much do you pay for a hygienist?
Well, the hygienist wage varies by state and varies by how many applications come in for the position. So like here in California, they make significantly more than they got paid in Texas. And there's one office in particular that we just weren't getting. I'm not affiliated with it, but just as they were trying to staff it, there wasn't really any good hygiene candidates. So the girl who ended up taking that job is making more than the other hygienist. So it varies by location significantly.
And if you want to know the exact amount, we can always talk a little bit later about that too. I really want to do. You kind of already mentioned this, but I'm going to ask it. I really want to do implants. Does Aspen do implants?
Oh, absolutely. So Aspen's just so in the same way that they rolled out that Invisalign program I mentioned a couple of years ago. It was actually during quarantine that they rolled out this pretty cool implant program. So we hired on this prosthodontist. His name's Dr. Rawal. Really successful. I think he's lectured worldwide, and he's been doing online courses and online CEs, basically from start to finish. Just from restorations and impressions all the way up to guided surgery, overdenture, all on four. So he has rolled out a very comprehensive program that I spent 3 hours a day for 6 straight weeks watching his stuff, because that's what got me through quarantine was his content training us. But they just signed a contract with this company. I think they're in Europe, but it's called Swiss Meta. So like, let's say you're placing implants and you're early on in your career. You take the cone beam, you can send the DICOM file to Swiss Meta, and they'll plan they'll track the IA, they'll plan the implant, and then they send it back to you. And then you can look at it with Dr. Rawal if you want, or you can just check it out yourself. And if you like it, great. You can just click accept, and then they mail you the 3D printed guide. So they have all that intertwined. Obviously, most offices have a surgeon coming through. So if it's a medically compromised case, sometimes patients just want to get sedated, even if it's a simple case. You work a lot with your oral surgeon placing those implants as well. And we also have a contract with Nobel. So we get Nobel parts, components for pennies on the dollar.
Sounds like a good deal to me. So finally, so we'll take another like 5 to 10-ish minutes. I want to be respectful of everybody's time. We'll finish off with kind of some of the stuff that's going on right now. I don't know if it's because somebody received our Smile Wide, Smile Safe initiative or something, but talk about office safety, obviously with COVID. What sort of changes are you making with patients now?
Yeah, so there's been a lot of changes, with both within the Aspen offices and just with everything. So what we're doing is longer patient appointments. So I'm not bouncing in between rooms as much as I once was. Once I sit down to do a procedure, I finish it before, and I, wash my hands, everything before moving to another room. Both myself and the whole staff, we're wearing changes of clothes. So like I go to the office in gym clothes, I'll put on my scrubs, and then I'll change back into the gym clothes before I leave for the day. Then yeah, like I mentioned, longer appointment times, nobody in the waiting room. So like people are wait in their car until we have their room ready for them. So we seat them straight into their operatories, and then, no companions. They can't come with their whole family or whatever. Temperature checks, checking everybody's temperature when they come in, asking them the questionnaire off the ADA website. Have they been exposed? Have they traveled internationally? So just doing a lot of that stuff up front in the operatory. So, wearing the N95 mask with a face shield and a gown, in addition to what I usually do. Which is a lot more bearable now, because right when all this was happening, all of the good PPE was getting directed to hospitals, and it was just low on stock. So the initial batch of PPE I got was literally trash bags with a hole in it. So I was in the room sweating, but that was only for about a week, and then they started the good stuff, the breathable PPE started coming in. So it's I'm used to it now. I'd say the one thing that is getting in my way, and this is probably the case for everybody, is my loop light. Wearing the face shield with my loop light, but at this point it's not a big deal. Everyone's used to it.
That's good. Are you using Tele Dentistry? Did you ever use it before?
So me personally, I'm not. I know, so my office, right before the lockdown, my latest office was only open for a couple months. So, we didn't have a massive recall patient base that we were their dental home. For a majority of the more established offices, they did roll out a teledentistry program, so that if someone had something going on, they had some swelling, some bleeding, they could reach out to their doctor to ask some questions. So yeah, me personally, I'm not, but I know in some markets they are doing some teledentistry.
Cool. So final question, non-dental related. You ready? This one came anonymously. If you can have any beer that you want, which one would it be?
Oh man, so I don't drink anymore.
Good
I
for you.
Yeah,
It's a
I cut
bad
all that
habit.
out. I was gaining too much weight, so I'm trying to live a little bit healthier of a lifestyle. So I'm really not on the beer train anymore.
If when you were on the beer train, what was your go-to?
Oh man, definitely an IPA, like a Stone IPA, something like that.
Cool.
Or a Natty Light was always good. I was never picky.
Back to the college days, right?
Yeah, right.
Well, that's all the questions that I have listed here. Obviously, if any more of them come in or if you have any other questions, we'll be able to, answer those on a one-on-one basis. Again, I want to make sure that everybody that might have joined just a tad bit late can see that we do have an opportunity for free CEs for not just currently practicing dentists, but dental students and everybody in between. So if you go at the bottom, if you see there, it says aspendentalce.com/welcome. You have that ability to take advantage of those. There's a library of thousands and thousands of CEs on top of new live upcoming CEs that are all done online. And again, this is an opportunity that we're offering out to everybody, and that's kind of the perk of joining. So I want to first and foremost say thank you so much. Thank you, Dr. Evans. Do you have any final words to say to the UCLA students, any dental student, any currently practicing person before you go?
Yeah, what's up? Thanks for coming, guys. If you guys really have any questions, feel free to ask Derek. He said he's going to put my information up. I'll
It's
give
right
you guys.
there.
Yeah, you can email me. You can get my cell phone number. If you guys are located in Southern California and you want to come out to Palm Desert and spend a day in my office, I'd be more than happy to have you guys out. So, yeah, just feel free to ask any questions, and I'd be happy to talk to anybody.
It's a good man right there, I'd have to say. Thanks
Thank
for everything. As of right now, we are pretty much all done. So for everybody that wasn't able to make it, please make sure and let them know if they signed up that I'll send them this information. And other than that, thanks everybody. Have a good night. Thanks again, Dr. Evans. I'll see you soon.
Bye. Thank you.
We'll
Bye.
talk soon. Thanks, guys. Bye, everybody.